Namaskar, dosto. Good evening, friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist. And you're watching Dr. KK's Med Talks. But this is a talk show with a twist. We'll be talking about the secret of sporting success. Now, if we need to talk about the secret of sporting success, we need to know someone who is good at sports. So, our expert today is a sports medicine specialist. When we're talking of vitamins, hormones, then we need to know the physiology. Now, I wonder what physiology is. Let's talk about that as well. So, we need to have someone who is an expert at physiologist. So, a warm welcome to Dr. Barun Sharma. Warm welcome, sir.
Thank you very much, sir, for inviting me,
Namaskar,
sir.
sir. Warm welcome.
Namaskar, sir.
Dr.
Ji.
Dr. Sharma is a consultant in physiology at the prestigious BHU, Banaras Hindu University, the Department of Physiology there. He is also faculty in charge of sports, exercise medicine, and sciences. And he runs the sports and interventional physiology lab, also the performance and lifestyle medicine lab. He is president of the Indian Society of Sports and Exercise Medicine. So, warm welcome, Dr. Barun.
Thank you very much, sir.
Dr. Barun, we have doctors from across the country and beyond as well. We also have people from the general public. And greetings to you from Swapna Jain ji. Madam is an advocate for healthy living from Vellore in Tamil Nadu. And we also have Dr. Siddharth Dhangar, who is an upcoming diabetologist doing very well in practice. So, just to sort things out before we begin, what does the word physiology mean, sir?
Sir, physiology is a broad term. It is the study of life, the study of life. Anything related with the life is actually the physiology. And here we basically deals with all the normal processing, सब कुछ normal processing regarding how the life, how the interaction between different cells, cellular physiology, different tissue, different organ, different individual. So everything from the molecular basis to the, the organism, the individual itself, the study itself is basically the physiology. It's a very broad science.
Can anyone survive without physiology? Can anyone thrive or succeed without knowing physiology?
Without knowing physiology, I think at this time, physiology one should know physiology because physiology form the basis, sir. I mean, if you want to if you want to understand the interaction, between different organ and different thing, you have to understand physiology. If you want to go to the sports performance is nothing but the stretching of the ability, that is physiological limit. So you have to know the physiology. And if you go to the pathological side, like bimari, disease, and all that stuff, you have to understand the physiology because without the baseline, without the physiology, you cannot, you cannot understand, the disease process, the treatment process. So everything depends on the understanding of physiology, sir.
So, in modern life now, there is so much of stress, so many things going on. So, how did our experts in physiology begin to understand about
I'm
stress?
not able to hear you, sir,
Okay,
properly.
that is the stressful situation now because we are speaking of stress. So, the question is, how did modern physiology understand what stress means?
Can you please repeat the question? There was some problem
I think there's an issue now. I'm not able to understand.
in my. Sir, can you hear me,
Can
sir?
we retry again, Dr. Barun?
Hello.
Yeah, I can hear you now, but very faintly. It was fine earlier. Can you hear us now?
Okay, okay. Actually, the sound system, the sound system was not good, sir. So I cannot hear your question, sir. Can you
So
repeat
our
it, sir?
question is, yeah, our question is about stress. How does
Okay, sir.
how does the physiologist view stress?
Uh, Sir, physiology basically views stress, the stress which is good for the body, that is within the physiological limit, because some amount of stress is important, because if you want to adapt, then stress has to be there. So hormesis and, within the physiological limit, like for example, exercise is a type of stress, but it is a useful stress. But when you overdo it, when you extend, when you cross the limit of physiology, then it goes into the chronic stress, pathological stress, where it forms the basis of lots of disease of lifestyle and everything that's got into the physiological domain. So we basically deals with the physiological step, how to implement the physiological stress, how to monitor it, and how to keep the stress within the physiological limit, so that physiological adaptation happens, good adaptation.
Yeah. And your voice is back now. This is also a kind of stress that we face. We are, again, the disturbances come. We are speaking to people from not only across India, but from other countries as well. And we welcome Dr. Noor Agha Danish from Kabul in Afghanistan. Dr. Barun, he sends you his salam and adab.
Namaskar, sir.
We also welcome Rajendra Jain ji and Puneet Kumar Yadav sahab, also Manoj Tripathi ji. So when you are faced with stress, uh, what are the options, Dr. Barun? Either we can run away from stress and we can just pretend to be like an ostrich, let the stress pass over. But will that work? Or otherwise, what are the options we have when we are faced with any kind of stress? Yeah, again, I think there's a audio issue. There's an audio issue. In between, it's fine, Barun. Can you check your connection? Yeah. Now it's
Fine,
perfect.
sir.
Perfect.
Now, sir.
Perfect.
Okay.
Perfect.
So, so the point which I want to make, sir, is the two things you can face the stress. The first one, the reaction, the stress. Suppose if you are not able to control the stress, then at least you can control how you react to the stress. This is also the teaching of our spiritual, adhyatmic level teaching. And from the physiological point of view, we increase the resilience of the body. How much your body can the challenge, accept that stress. That resilience, that fitness level, mental fitness, physical fitness, that has to be increased so that we can easily tackle the stress. So it can be an answer from the adhyatmic, that is spiritual point of view, and from the physiological point of view, by increasing your tolerance levels.
Resilience is an important word, and greetings to you. Assalamu alaikum from Fatima ji, who is a student in Pakistan. Resilience is important because that is necessary if you have to go through student life, and if you have to handle your teachers, the multiple demands that are placed upon your brain and your body both. There's a lot of work to be done. But speaking of resilience now, and coming to our topic today for vitamin D, what is the state, what is the physiologic state or the pathologic state of the average South Asian citizen, any country of South Asia? What is our nutrition like, our lifestyle, our exercise? We are blessed with a lot of sunshine. What is our lifestyle like? What happens to our hormones and our vitamins?
Yes, sir. Regarding which two, three things which I want to say. The first one is, in India, you must be knowing, the South Asian phenotype, famous South Asian phenotype, where abdominal fat deposition is there, where muscle mass is very thin. So this type of phenotyping is present in South Asian country like India. Because of that, it predisposed to many metabolic abnormality like type 2 diabetes and central obesity and all that stuff. Again, another point which we one thing is our nutritional, most of the nutritional habit, they doesn't contain that adequate amount of the proteins. Protein intake is relatively lacking, and the more carbohydrate we are taking. So that thing we have to understand also. And another point which is very much relevant to our today's topic is regarding how much we are going in the sun, walking in the sun, sunlight exposure. Sunlight exposure is very limited, and because of that, in spite of the living in relatively near to the equator, tropical area, vitamin D deficiency is so much prevalent, very high among our society, not only among our society, general population, but also in athlete also. So all this thing from nutritional point of view, from all this thing we have to consider, before recommending any kind of the intervention.
So this is a challenge that we face. Dr. Barun, are we born with this kind of a phenotype? Everybody from South Asia, or almost everybody. And this question is asked by Kushal Raghavji and also by Dr. Kiran Kulkarni, who is a leading sports medicine specialist from Karnataka.
Namaskar ji. Sir, the thing is, there are so many, hypotheses regarding the South Asian phenotype. Like, for example, the famous the famous hypothesis regarding the survival in famine. Repeated famine, survival of repeated famine is there. Very interesting hypothesis, which says that Indian population, because of the repeated famine in the previous years generation, what they do is they basically start accumulating fat, because the fat is always the source of the fuel during your famine. And because of that, because of the subsequent generation, this typical deposition of the fat happens during among the South Asian population. This is one of the famous hypothesis regarding the the thin thin toffee, which is known as TOFI, thin outside, fat inside, thin outside, toffee phenotype. And another point is also the dietary habit. Dietary habit, like I've already told you regarding the relatively lower intake of the protein. Protein is highly neglected. Highly neglected. We always focus on carbohydrate, fat, and fat restriction, carbohydrate, this and that, but protein seems to be neglected. So sufficient amount of the protein intake accompanied with exercise. India as such, it is one of the highest country having inadequate physical activity. There are physical activity guideline prescribed by, say, WHO, like ACSM, the American College of Sports Medicine, but we are not meeting the guideline. So physical inactivity guideline accompanied with the dietary habit, which is lacking good quality protein, plus because of our history, from repeated famine and all these things, all these things may be related with the type of the phenotype which we are having. So this is just a hypothesis, sir.
But the point is very true. We welcome Ali Nazakat Sahab and also Dr. Anshul Singhai, who is a diabetologist from Chhattisgarh, from Bhilai. This concept is quite easy to explain to our patients, actually, to our farmers. So speaking in Urdu, speaking in Hindi, जब आप कोई पौधा उगाते हैं या कोई बीज उगाते हैं, whenever you plant a seed, आप उसको पानी देते हैं, खाद देते हैं, you give it water and fertilizer. That is the food, macronutrients as well as micronutrients. And so far you see that Dr. Barun is speaking about macronutrient, that is protein sufficiency, which is important. आप पौधे को खाद भी देते हैं, पानी भी देते हैं, आबो हवा, that is water and atmosphere, और सूरज, धूप, you give it sunlight as well. मगर जो अच्छा फार्मर है या किसान है, वो क्या करता है, वो ट्रिमिंग भी करता है लीव्स की, या वीडिंग करता है. तो ये जो एक्सरसाइज है वो भी हमें करना है. वो बिल्कुल ऐसे ही है जैसे आप पौधे की ट्रिमिंग कर रहे हैं या पत्तों की ट्रिमिंग कर रहे हैं. यू डोंट वांट ग्रोथ टू बी maladaptive. You don't want the growth of the plant to be non-productive. तो हम मोटे होते जाएंगे, that is anabolism according to the physiology dictionary, but it is a maladaptive anabolism. It's not going to help you too much. अगर वाकई famine है, या you feel that famine will come after 6 months, फिर तो ठीक है. Then you go ahead and you allow yourself to become fat and obese and get adipose tissue. But जब आपको confidence है कि food security है, famine नहीं है, then this maladaptive anabolism is going to be of negative impact. So, like Dr. Siddharth also says, you can explain to the farmer, you can explain to the gardener as well. And thanks for that. मगर डॉक्टर साहब, हमने अभी बात की of macronutrients. Let's come to micronutrients, and we want the secret to sporting success. Now, earlier we used to see that our South Asian teams used to do very badly on the international arena, but now recently in the Asiad, the Afghan team did very well, and unfortunately they lost out to the gold. Actually, both Afghanistan and India should have shared the gold medal for cricket, but their boys did very well. All the South Asian teams did very well at the recently conducted World Cricket Cup. So 3 cheers for all our boys. Our girls are doing well. They are winning gold medal in the hockey games. So a great Himalayan explorer and Anshul Sengai, they all ask you, sir, what is the secret to sporting success? What are the micronutrients that are needed? Vitamins, minerals, and electrolytes. Three of these.
Yeah, yes, sir. See, there is no one single magic secret for sporting performance excellence. This we have to understand. It is a multi-factorial this thing. So we cannot say only nutrition is responsible or training is responsible or sports science setup is responsible. So it is a contribution from the different sectors. And regarding micronutrient intake, sports nutrition plays an important role not only to maintain the baseline fitness but also to meet the physiological demand of that particular sports, because each and every sports has different physiological demand. Your body have to distinct regarding for example, in today's topic, pertaining to today's topic, vitamin D is extremely important, like I have already told you. In spite of the living near the equator, vitamin D deficiency is very, very high among the athlete. This one has to understand. So vitamin D, sometimes we have to give vitamin D supplementation depending upon certain, tests, because high-end athlete, we have to do certain kind of tests, which we can elaborate a little bit later on. Then there is also requirement for iron is very important. Like for example, for female case, the iron, iron deficiency anemia is prevalent among the athlete also. This one has to understand. And deficiency of the iron, deficiency of the vitamin D, deficiency of the magnesium, all this, has an important impact on the detrimental effect on performance. So this thing one has to understand. And the calcium is also important. Calcium, magnesium, iron, and all other, the supplement which are like, for example, selenium, chromium, which are important to maintain the baseline health. This one has to undertake for the athlete. But the one thing which I want to say regarding the supplement, because in athlete, just prescribing supplement should not be there, because there is WADA rule is there. So athlete में हम लोग कहते हैं कि regarding the supplement, 3 things are important. Number 1, मतलब 4 things. Number 1, हम ये कहते हैं कि you should always try to avoid supplementation as far as possible, because proper nutrition, proper balance, well balanced, well designed, personalized, dietary plan is number 1. It should be number 1. If you are deficiency in, say, some particular distinct, then you supplement, in the form of a proper food, whole food, not some supplement in the for tablet or something. Then this is number 1 rule. Number 2 rule is, if you see any kind of the supplement, तो उस supplement में जो लिखा हुआ है जरूरी नहीं कि वही हो. This one has to understand, because कुछ भी हो सकता है. And third point is, वो supplement में जो लिखा नहीं है वो भी हो सकता है. That can also be present. So that is not written in the composition. And last point regarding the supplement, which one has to understand, अगर लिखा भी होगा वही भी present होगा, but the thing is we are doubtful that that particular supplement actually enhance the performance, because regarding sports nutrition and all this thing, जो भी available literature है, they are relatively associative studies. Associative study, not the causative study. So this thing one has to understand as far as supplement is important. So diet is most important than supplementation under a guidance of a proper sports medicine doctor or sports nutritionist. This one has to do. This is the approach.
I would like to reinforce what Dr. Barun is saying. 2 things. First of all, if you need a supplement, let us say, like Dr. Anshul says, there's a sportswoman who needs medicine for thyroid. Then you will take the thyroid medication. If somebody has diabetes, they will take insulin or the anti-diabetic drug. WADA does not prevent you from doing that. You can have thyroid and diabetes, you can still go and win a gold medal in the Olympics. But of course, you have to declare that this is your disease, this is what you are taking. When you go to take the thyroid or the diabetes medicines, you take medical grade medicines, is it not? You take something from a good pharmaceutical company. Similarly, if you are vitamin D deficient, then you will take vitamin D which is of medical grade. You will not take an unproven supplement. That is one strong message. The second is for the younger boys and girls who maybe go to the gym. I go to the gym and I see all different sorts of people. There are 80-year-old gentlemen and ladies coming to my gym. There are also 18-year-old boys and girls. And the younger boys and girls are always looking at their mobiles and talking of supplements. That is their normal gossip. Sometimes I wonder at age 25, why don't they talk about other things, the boys and girls together? There are so many healthier endocrine things to speak about, but they are all fixated only on their supplements. And I bought such and such supplement for $80. The other guy will say, oh, I bought for 80 pounds. And another person will say, why are you buying? I talked to my auntie in Canada and she has sent me 4 boxes. So that is something which is wrong. You should not put things into your mouth when you're not sure of what is in that.
Absolutely, sir. Absolutely.
Dr. Siddharth, Dr. Anshul, they talk about a holistic approach and they talk about the banyan tree. So this question, Dr. Kiran is also talking about that. Sports medicine is like a banyan tree, multiple roots, multiple branches. The banyan tree itself does not give you firewood. It does not give you wood that you get from teak, from so many other things. But in South Asia, nobody worships teak wood or sandalwood. However, we do worship the banyan tree. So, sports medicine, the banyan tree, what does this mean to you, sir? And what message does it convey for all people? And our topic for today is Secret to Sporting Success.
Yeah, sir. See, sir, sports medicine is actually multidisciplinary and the interdisciplinary branch, actually. So, I mean, sports medicine may only two important science field you have to understand if you want to excel in sports medicine. One is performance science, sports science, performance science, health science. Another is the medical science. So, these two broad science has to come together. So another treatment purpose, treatment, rehabilitation of injury, illness, everything is there in one branch. Another is the performance science, sports science, sports nutrition, different thing. This two thing has to come together so that we can provide a holistic way. So sports medicine include not only injury treatment, but it also include say treatment of the illness, exercise associated different thing. Like for example, sudden cardiac arrest is there. For example, exercise induced bronchial asthma, bronchospasm is there. Or say diabetic, type 2 diabetic or type 1 diabetic, how to go about with exercise. Or say hyperintensive patient. So all these things come under sports medicine. Another is a rehabilitation of the injury. If suppose an injury happens, then our aim should be as soon as possible, as fast as possible, the athlete has to go to the ground, playing field, with all the function intact, with all his performance. So that rehabilitation side is also there. And before the operation also, if suppose an athlete require an operative treatment, so before going to the operation, then we build up the baseline, we leave the fitness so that more proper quick return to the play can happen. This is known as prehabilitation. That thing also comes in sports medicine. Then performance enhancement side, by say nutritional intervention. What type of nutrition what type of nutrition you have to give, and what type of the physiological intervention, like for example exercise, what type of exercise training you have to give, what are the psychological intervention, so all or what are the biomechanical analysis. So everything comes under sports medicine. So a sports medicine doctor has to understand everything, sir.
Point well taken. And we take this question from Dr. Mahesh. One of the nutritional interventions is vitamin D. So he asks, is vitamin D injection recommended in severe vitamin D deficiency? Sir, when we were students, even when I was a young consultant, this was the treatment of choice. But now we know that when you give vitamin D, it actually increases the vitamin D levels to supraphysiologic levels. And then after that, the levels come down. So many patients do come and say that, yes, I like vitamin D, I like the injection, I get a kick out of it. But it's not a sustained effect. And the quality of our oral vitamin D preparations is very good now. The bioavailability, the absorption is equal with oral and with injection. So actually, oral is preferred now. That in vitamin D injection, we should stop using. Another aspect is misuse of injection vitamin D. Now, each and everything that is available on earth can be used and can be misused. So when you see reports or when you hear reports of people being addicted to shoe polish, people being addicted to thinners, you also see that many patients get addicted to injections, whether it is anabolic steroids or hormones or vitamin D, so that we should avoid. Recently, in my gym, what I saw was that one of my patients, who is a type 1 diabetic, he was going. So he happened to tell a few people that I use insulin because I have diabetes.
Mhm.
And after a couple of days, two people came back to him and said, "Tell us what injection you are using." So he told them, and then he
Mhm.
said he was just curious. So he said, "Why?" So it turned out that those two young boys, they were using insulin
Mhm.
as a drug for happiness, the same way that one would use a street drug or heroin or opium.
Mhm.
The same way they were using insulin. They had got an idea that if you take a many units of insulin, then you will get hypoglycemia and you will die for a non-diabetic. But if you
Mhm.
take just 2 or 3 units of insulin, then it just goes and trickles your brain, causes neuroglycopenia, and you get a
Mhm.
high, HIGH high, and then after some time you come back to normal. So they were trying to enhance
Mhm.
that. So
Mhm.
please stay away from such injections. And coming back
Absolutely.
to, yeah,
Mhm.
coming back to vitamin D, Dr. Barun, a question from Dr. S.P. Singh is, where is, from physiology, where is vitamin D formed in the body? Is it formed in the in the skin, or in the kidney, or in the liver?
Mhm. So that's right, sir. Vitamin D. One we have to understand this is the supplementation nutritional source of vitamin D. Constitute around only say 20%, 10%, 10 to 20%. But the rest has to come from sunlight, from the skin. Very important. So 7-dehydroxy, cholesterol is the precursor for the pre vitamin D. When UV radiation, UVB, there are A, B, C type of the UV radiation, ultraviolet radiation. So UVB is the one which triggered the formation of the vitamin D. It is also known as vitamin D3. That is the cholecalciferol, technically, chemically cholecalciferol. And that cholecalciferol is basically from 7-dehydroxy cholesterol in the skin, from in the skin. Then it has to go to the liver because it is not the active form. It is not the active form. So it has to be activated, and two types of activation occurs. One is at the liver, another is the mainly in the kidney. So that biochemically, if we speak, that is known as hydroxylation reaction, OH, hydroxylation. So that cholecalciferol, it has to go to the liver, and liver, one enzyme is there at the 25 position, hydroxylation happens. It forms, they activate the vitamin D. Now, it is also still not, fully activated. It has to go to the kidney. And in the kidney, there is one enzyme known as 1-alpha hydroxylase, and that finally activate the vitamin D, that is the calcitriol. We also call it calcitriol. It is the active form. There is 125 dihydroxy vitamin D, that is the active form. So whatever supplement you are taking is not the active form. Whatever supplement, it's a D3, that is cholecalciferol. It has to go activated at the liver as well as in the kidney. So
Kidney.
this process one has to understand.
And Dr. S.P. Singh also asks, is vitamin D supplementation safe in people with CKD, chronic kidney disease?
See, it is one of the typical, this thing. See, I've already told you what does the physiology says. Physiology says that in the the final activation of 1-alpha hydroxylation occurs at the kidney. So if there is any kind of the kidney dysfunction, especially in the PCT, it happens in the proximal convoluted tubule in the mitochondria. If you want to precisely understand the physiology, and if that is dysfunction, that means active form of the vitamin D may not be synthesized. And in that condition, active form of vitamin D may be required because vitamin D is important for so many functions, especially for osteo. It can lead deficiency can lead to osteomalacia, and bone mineral density can drop, and there are so many extra bone function of the vitamin D. So vitamin D, intervention, supplementation is required in case of the CKD, but it has to be it has to be monitored because sometimes this thing one has to understand to biochemical. I will just say two important things. For the activation of the vitamin D3, you require magnesium as a cofactor. So if you take lots of vitamin D, if you are magnesium deficiency, that again your vitamin supplementation is useless. So magnesium has to be supplemented. And number two, there are certain protein vitamin D, produce protein which require, vitamin K for function. And this vitamin K is another important, that is known as carboxylation. Biochemically, if you speak, physiologically, if you speak, vitamin K does what is known as carboxylation. So carboxylation is required for the proper functioning for the vitamin D. So sometimes, like for example, if you take lots of vitamin D, then the calcium, absorption from the GIT will happen. Your calcium level will increase. That calcium, what is the surety that calcium will go only to the bone? Why cannot it go to the blood vessel? Why cannot it deposit in the blood vessel? That is decided mainly by vitamin K. So vitamin K2 supplementation is also required. So vitamin D, vitamin K2, magnesium, and this may form an important role in case of the CKD patient, especially if you use say warfarin or some drugs which are vitamin K antagonists. In that condition, then if you do lots of supplementation of vitamin D along with the calcium in case of the CKD patient, then lots of side effect can happen where extra tissue calcification can happen. This is known as calciphylaxis. That is the medical term. So all these things can happen side effect. So by just understanding the basic physiology, you can apply the knowledge and you just have to think. Everything is logical.
That's true. And if you use native vitamin D, that is cholecalciferol, the chances of toxicity are minimal because that vitamin D that you give there are two more checkpoints. It will go to the liver, it will go to the kidney. So there are those checkpoints, those balances like dams. You will not have a flood of vitamin D. The liver and kidney will stop the vitamin D from creating problems. So if you're taking vitamin D oral preparation, maybe 60,000 units once a week, there are many checks and balances. You can take it safely. In some countries, they do check vitamin D for everybody. But in India, vitamin D deficiency is ubiquitous. Same is true for Pakistan and Afghanistan. 90% of the population has vitamin D deficiency. So you can use. Dr. Barun spoke about monitoring. And in people with renal osteodystrophy, we monitor IPTH, intact parathormone. That is the investigation of choice to screen, to diagnose, and to monitor people with renal osteodystrophy in chronic kidney disease. So you don't want the PTH to be too high because otherwise it will have a catabolic effect on the bones. You don't want it to be too low also because then otherwise again you will go into catabolism. Mr. Anup Sharma, sir, is an industry leader. He asked, sir, you just spoke about bone, osteoblast. So two questions separately. First, let's talk about muscles. What is the role of vitamin D in muscle health? And how does that help us in sporting success?
Absolutely, sir. So we have to understand, I will again take you to the physiology and biochemistry. So in order to understand the function of the vitamin D, you have to understand where does the vitamin D act. Vitamin D is just like a hormone. You have to understand it is not it is also a hormone. So vitamin D receptor is there in the cytoplasm, which act to the nucleus and increase transcription of the messenger RNA, and a protein synthesis is there. And that protein can be anything, and mostly related with the bone, and it can also related with the muscle. It can also related with the immune function. So lots of things can be done. So these are known as genomic function of the vitamin D, because since it involves the protein synthesis, it will take some time. And another is the non-genomic function, where receptor of the vitamin D is there in direct receptor activation, and it will causes function of the this thing. And regarding the muscle health, very important vitamin D. There are lots of important functions, like for example, protein synthesis. Muscle protein synthesis is an important, one of the important functions of vitamin D. Like there are so many different types of the muscle fiber, especially for type 2 fiber, strength. Type 2 is related with the strength. So type 2 muscle fiber, that vitamin D is important. So how do we know that vitamin D is important? Because if vitamin D deficiency is there, then muscle weakness happens, muscle pain happen, fibromyalgia can happen, and chronic fatigue syndrome, can happen. Sarcopenia can happen. Loss of the muscle mass can happen. Dynapenia, loss of the power and strength of the muscle can happen. So vitamin D is very important, especially for deficiency. If you keep on supplementing the vitamin D, it doesn't mean that your performance will increase. It doesn't act like that. Deficiency is important. You have to prevent the deficiency. But if you overtake it, that is also not good. So one we have to understand is, for as far as muscle function is concerned, regarding the muscle mass, preservation of the muscle mass, preservation of the muscle power, muscle force, that is known as muscular fitness, vitamin D deficiency has a detrimental effect. So we have to make sure the athlete or a particular person does not suffer from any kind of the vitamin D deficiency, because this should be kept in the differential diagnosis when you're concerned. Like for example, chronic fatigue. If a particular athlete is coming to you, with having a chronic fatigue or say overtraining syndrome, then you have to keep all this in mind, where nutritional, this thing, biochemical, investigation can be done, and depending on that, then intervention we have to do.
For elite athletes also, the level of investigations will be totally different, that we have to understand. If we are in private practice or in primary care, like Dr. Anshul, Dr. Siddharth, myself, Dr. Pradeep Rawal has joined us. He's from Ujjain in Madhya Pradesh. Then the number of investigations that we do is much less. But if you're dealing with an elite athlete, and there, 1 microgram, 1 nanogram vitamin D extra can actually make difference between bronze medal and gold medal at Olympics, then the level of investigations will be different.
Perhaps.
Speaking of muscles, and this is to answer Mr. Sharma's question, another common situation that we see is myalgia in the OPD, that is drug-induced myalgia. It can be because of beta blockers. It can be because of statins, which we use in cholesterol lowering and in heart disease. Here also, supplementing vitamin D helps in preventing the myalgia. So for people not only with kidney disease, but also with heart disease, vitamin D should be optimized. The second question was for bones. So role of vitamin D and bones. What are osteoblasts? क्या बनता है osteoblasts से? What are osteoclasts? क्या कटता है osteoclasts से? And how does vitamin D help us balance the blasts and the clasts in the bone?
Absolutely, sir. So again, going to the basic physiology. So two cell, like sir has already mentioned, osteoblast, that is bone forming cell, bone laying down, and another is osteoclast, bone resorption. It causes resorption of the bone. That is bone degradation. Bone degradation. So these two, balance of these two is very important. And why? Because of our bone is not static; it is very dynamic. Depending upon your requirement, the bone formation, bone adaptation has to occur. So if it is a dynamic process, then only it can happen. So because of that, this interplay of these two, osteoclasts and osteoblasts, is very important. And regarding the vitamin D, vitamin D has an important role, on the deposition of the calcium and phosphate. Vitamin D, important function of the vitamin D is mainly two. That is, it increases the calcium absorption from the GIT, from the kidney, and also phosphate. Not only calcium but phosphate. And you know that bone is mainly mineral, hydroxyapatite, that is calcium phosphate with OH negative ion. So the bone mineralization, vitamin D has an important role for bone mineralization. Say, suppose if you are if your say osteoclast resorption, if some defect is there in osteoclast, then what will happen? Abnormal bone laying down will happen. That is known as osteopetrosis. And if there is a excessive osteoclast cell is there, then what will happen? Osteoporosis can happen. So osteomalacia can also happen. When osteomalacia has happened, when mineralization doesn't happen, so your bone will be soft. Because mineral make it strong. So mineralization doesn't happen, osteomalacia. If everything, the mass decreases, that is the osteoporosis. So depending upon which type of cell is involved and what type of process is involved, different disease is there, and treatment is also different.
Point well taken. And you do need vitamin D continuously. Nitin Urujai points out that if we stop vitamin D for a few months, the levels go down. That's true, because it is a part of life. You have just the way we drink water every day, we eat food every day. Vitamin D, though it's a hormone, you have to take it from outside, whether from the sunlight or from nutrition. And the correct maintaining dose would be something like 60,000 units once a month, forever and ever, Nitin, as long as you want to be healthy. Of course, if you are at a high risk level, a phase of life, maybe somebody who is in the post-menopausal age, maybe chronic kidney disease, just started high dose statins and complaining of myalgia, Maybe you're going for an intensive physical activity regimen in the gym or in
Yeah.
sports. Then you may want to increase to once in 15 days or once in a week also. But forever and ever, it should be 60,000 units once a month for every adult. Sir, greetings to you from Dr. Aditya Chandarana, who is from Kuch in Gujarat. And he asks, why is vitamin D not included in, let us say, milk, for example? Is it considered adulteration? Why do we have to take it separately?
Sir,
Why don't they iodize, like they iodize salt? Why don't they vitamin D fortify everything for us?
Sir, this is very important question. For it has to be fortified. One has to understand the natural source of vitamin D is very, very limited. Very, very limited. Like for example, vitamin D2, there is argocalciferol. It comes from a fungus. Fungus like shiitake fungus is there, and that is the plant source K2. D2. Then vitamin D is mainly comes from say cod liver oil or fish oil. Certain oily fish. So that's why the dietary natural source of vitamin D is very, very limited. So that's why, and in today's world where your exposure to sunlight is very, very limited, so fortification it has to be done. It can be done in the milk. It can be done any kind of the diet. Even some fortification can be done on the cereal and all these things which you are eating. But one thing you have to understand: it is a fat-soluble vitamin. It has to be taken with the fat. For proper absorption, this thing also one has to understand. So fortification, I think it should be done, and then only that pandemic of this what we call vitamin D deficiency we can counter.
One challenge is that the rules that have been laid down by the government in India are that when anything is added to milk, it is called adulteration. So that those rules were made in good faith. Like you don't want water to be added to your milk, for example.
Absolutely.
But so that is what prevents vitamin D fortification in milk, which would be the most natural sort of medium. So until then, until the rules change or until public health policy changes, we have to depend upon external supplements. And the general rule of thumb would be, heuristic would be 60,000 units once a week for about 3 months for everyone, and then once a month after that. But do be aware that each person is different. So your needs may be more, they may be less. And when Pratik ji asks, sir, how can I raise my vitamin D levels quickly? Apart from going to Goa or Pondicherry or Andaman Islands, any other ideas, sir?
Sir, this thing I've already told you, 90% of the vitamin D come from sunlight. Dietary is only 10 to 20%. Supplements only take care of that 20 to 20%. So if 35% of your body is exposed to sunlight for 20 minutes at least, 20 to 30 minutes, like for example 30 minutes or 60 minutes, say walk in the sunlight, then it will be then you may not suffer from vitamin D deficiency. This one has to understand. So exposure to sunlight is very important, which we are not doing. This thing one has to understand. So at least 30 minutes, say 60 minutes of walking in the jogging in the sun, in a park, that will raise your vitamin D. Yeah, and regarding the supplementation, sir has already told you there are so many regimes. Like for example, in player we use daily. Those can also be given, like say 2,000 to 4,000 international unit per day, or say sir has already spoken regarding 60,000 per week. So depending upon the requirement, you have to take at least 800 international unit per day. More than that has to be taken. Not less than that, because if that is less than that, that is not sufficient. But you have to understand RDA is very less. RDA for recommended dietary allowance for vitamin D is around say 600 international unit, and for say more than say 70 years or something, it is 800 international unit. So RDA is less. But in today's world where exposure to sunlight is very less, then you have to take higher dose.
Now, Dr. Barun, Pratik happens to be a handsome young man, a very dapper kind of a personality with lots of admirers. So there are many other ways of getting vitamin D. If you were to go to Bhojpuri music, Pratik, and where Dr. Barun works, Banaras, Varanasi, that is the capital of Bhojpuri music. So this singer called Shilpa Singh, she sings, "Mili vitamin D, hamra ek chumma se." Now many people will not be lucky enough to try that source of vitamin D, but because we know Pratik, and now I am very sure Pratik is smiling and laughing away. So try that, Pratik. Listen to Bhojpuri music, listen to this song by Shilpa Singh and then try it out. But be careful. There's another song on vitamin D, and this comes in mix of Hindi and Punjabi. It's Hindi, but with a very strong Punjabi touch. And this is from Baba Sehgal, who was a rapper about 20 years ago. So listen to this song on vitamin D by Baba Sehgal as well, and then you might get bright ideas. Speaking of bright ideas, and now Dr. Barun, join me. We wish Pratik and his colleagues all the best in their endeavor to find novel sources of vitamin D.
Yeah, sure, sir.
So Pratik and his friends the best. But speaking of bright ideas, Dr. Abdul Salam from Ayodhya, which is where they speak very good quality Hindi and Urdu, and they don't speak Bhojpuri too much. But he asks, sir, what is the role of vitamin D in insulin production? What is the role of vitamin D in immunity?
Very important. This is very important because I have already told you vitamin D has extra bone effect also. Vitamin D receptor is present in many of the cells. It also includes the beta cell of the pancreas. Beta cell of the pancreas where insulin production is there. So vitamin D deficiency has been associated with insulin resistance, with type 2 diabetes. So vitamin D, has been found there are different research has been done where vitamin D has been found to increase the insulin sensitivity, to increase the expression of the gene for insulin, for proliferation and differentiation of the beta cell, for the the receptor of the insulin, GLUT4 receptor in muscle. And vitamin D has been also be found to be associated with the many of the secondary messenger which improve the insulin sensitivity, like insulin-induced glucose uptake by the muscle. So vitamin D has been found to be very much important regarding insulin metabolic health, insulin, type 2 diabetes, and all that stuff. In the same way, immune function also vitamin D is very important. Vitamin D has been known as immunomodulator. It modulates the function of the immune cell. So it improved the innate type of the immunity. Like for example, vitamin D has been associated with the expression of so many protein, which are antimicrobial protein. And vitamin D has been found to reduce the pro-inflammatory cytokines. There are lots of chemicals which are known as cytokines, which are involved for the inflammation, oxidative stress reduction. So vitamin D pathway there is and that one alpha hydroxylase enzyme, which I mentioned that is present in the kidney, which is important for activation. That is also present in different extrarenal tissue, like for example immune cell, very important, like for the macrophages. It also monocyte. It is also present. So that means vitamin D has an important role. And understanding this mechanism, what people are doing is people are hyperdosing themselves to fight against different infection, like COVID infection with vitamin D. That is also not good, because what is important is deficiency is associated with the disease. But when you remove the deficiency, when you give extra physiological, extra pharmacological dose, very high dose of the vitamin D, that may not be associated with a good effect. This thing one has to understand. So you remove the deficiency, but you do not add on.
This is called the Goldilocks zone. So neither too much nor too little, neither too big nor too small. So stay in the Goldilocks zone. A personal comment from Mr. Pratik Manwani. He says, thank you, sir, for the suggestion, but I am doing well on traditional sources of vitamin D, and his favorites are sunlight and Uprise D3. That is his favorite. And another comment is from Dr. Siddharth. Dr. Siddharth has tried these novel methods of getting vitamin D, and he says going out into and this wonderful smiley, Siddharth, maja aata hai dekh ke. So this going out into the park and trying novel ideas of vitamin D and sharing vitamin D with each other, that he says he has tried in the past, and it helps actually. So because if you go alone to exercise or to play sports, then you get bored. But if you go with a loved one, that is Dr. Siddharth Dhankar's idea. If you go together, then you kind of persist, you adhere to the exercise regimen also, and that helps you in vitamin D.
Absolutely.
We welcome Dr. Vipin Sharma, sir is civil surgeon in Kangra in Himachal Pradesh. Also Anshu Singh ji. Two questions, sir. Jo Nitin Narula ji ka question tha, intramuscular dose, hardly any indication now. So at a public level, I cannot think of any indication unless patient is not eating, but those patients will be very sick अगर कोई orally खा ही नहीं पा रहा, तो they are not people who will be listening to KK Med Talks. मीना जैन जी को भी welcome करते हैं. Sir, a few questions if we can take it, nearly 8. Dr. Pradeep Rawal asks, is there any role of vitamin D in preventing dementia, in improving memory, in managing motor neuron disease?
क्या बात है, बिल्कुल बिल्कुल है सर. क्योंकि जैसे कि मैंने बताया कि विटामिन डी रिसेप्टर इज प्रेजेंट इन एवरीवेयर, इन मोस्ट ऑफ द सेल. इट इज आल्सो प्रेजेंट इन द न्यूरोनल टिश्यू, स्पेशली 2 न्यूरोनल टिश्यू में प्रेजेंट होता है. एक तो सब्सटेंशिया नाइग्रा व्हिच इज इन्वॉल्व विद पार्किंसोनिज्म. पार्किंसोनिज्म पता होगा आपको, like dopamine decrease होने से that happen. And another is the hippocampus. This hippocampus is very important for the long term memory and dementia and Alzheimer and all that stuff. So since vitamin D receptor are present in this thing, and vitamin D has been involved for the synthesis of the so many proteins which are important for the growth and development of the neuron, like for example neurotrophic factor. इसको neurotrophic factor कहते हैं, जो न्यूरॉन को डेवलपमेंट करने में हेल्प करता है. ग्लायल सेल जो है न्यूरॉन के अलावा देयर आर लॉट्स ऑफ अदर सपोर्टिंग सेल, दिस आर नोन एज ग्लायल सेल लाइक एस्ट्रोसाइट एंड ऑल दैट स्टफ. So ये सब डेवलपमेंट करने में vitamin D has an important role. So vitamin D deficiency has been associated, has been found to predict, a severe dementia in case of the Alzheimer disease, or it has been associated with, say increased incidence of the motor related symptoms of for Parkinsonism, like tremor, pen rolling tremor, mass-like phase or drooping. These are known as hypokinesia and all that stuff. So vitamin D has no doubt vitamin D has an important role for neuronal function, not only for a bone immune function, muscular function, but also for neuronal function.
Okay. And that partly answers the question by Puneet Kumar Yadav ji, who said that I have tremor on slight exertion. Do I have vitamin D deficiency? तो वो टेस्ट कराने से ही पता चलेगा पुनीत भाई. मगर आप दवाई तो ले सकते हैं 60,000 यूनिट्स once a week for 8 to 12 weeks and then see what happens. बट अगर ट्रेमर्स हैं तो बाकी चीजें भी देखें. इट माइट बी फिजियोलॉजिकल. अगर एज बहुत ज्यादा, इट माइट बी रिलेटेड टू एज. That's called essential tremor. It's part of life. And it might be thyroid also.
बिल्कुल बिल्कुल बिल्कुल.
We'll just take a few more questions. Aditya Chandarana ji कहते हैं, maybe Dr. Barun and I will not be able to answer. Why do different companies price their vitamin D at different rates from 10 to 75 rupees? So
quality. Maybe bio, there is something on bio availability. आप कितना ले रहे हो, कितना बॉडी में absorb कर रहा है, depending upon their pharmacokinetics, all this thing. Maybe better formulation, all this thing. Maybe we don't know. But the thing is, आपको एक चीज तो समझना पड़ेगा. विटामिन डी और विटामिन डी का जो है ना, वो एस सेपिड होता है, ऐसे जैसे एस सेपिड. तो विटामिन डी को डिफिशियंसी को नॉर्मल लाने के लिए हायर डोज की जरूरत हो सकती है. जितना है उससे ज्यादा एस सेपिड, यानी एस का जो नीचे वाला है ऐसे आता है, ऐसे एस सेपिड. और उसके बाद हायर डोज, अगर आप एक रिप्लेनिट है, यानी आपका विटामिन डी सफिशिएंट है, तो आप ज्यादा डोज देने से आपका फायदा नहीं है, वो फायदा इंप्रूवमेंट नहीं होगा. So this thing one has to understand. और दूसरा एक और important point विटामिन डी से, जो from physiological point of view, विटामिन डी का जो टॉक्सिसिटी है वो बहुत रेयर होता है, बहुत जनरली रेयर होता है. इसीलिए आप देखे होंगे कि विटामिन डी को हम ऐसे ही प्रिस्क्राइब करते हैं, वो जनरली रेयर होता है. और हम ये बोलते हैं कि अगर if it is more than 60 नैनोग्राम पर ml ब्लड में, 60 नैनोग्राम एक टेस्ट होता है विटामिन डी का, वीनस ब्लड से निकाल के हम लोग करते हैं. एथलीट में तो हम लोग कॉमनली करते हैं. तो उसमें 60 या से अगर आपको मिलीमोल में अगर करना है तो मिलीमोल में 180 के आसपास आता है, मोर देन 180 मिलीमोल पर लीटर. हाँ, नैनोग्राम माने नैनोग्राम में अगर देखेंगे तो मोर देन 60 नैनोग्राम पर ml. तो ये डोज जनरली एसोसिएटेड विद एडवर्स इफेक्ट ऑफ विटामिन टॉक्सिसिटी. और ये मेनली बिकॉज ऑफ द हाइपर कैल्शियमिया. कैल्शियम इतना लोड हो गया है आपकी बॉडी में, थ्रस हो गया, नोसिया, वोमिटिंग हो गया, अल्टीमेटली कैल्शियम स्टोन फॉर्मेशन हो सकता है, किडनी डैमेज हो सकता है, और मेंटल दिस थिंग कैन हैपन. तो ये थोड़ा सा रेयर है, मगर पॉसिबल है. इसका मतलब आप अगर खुद से सप्लीमेंट, लाइक फॉर एग्जांपल 60,000 आप रोज 60,000 अगर खा लें इंस्टेड ऑफ द पर वीक, इंस्टेड पर मंथ, then this thing can happen. So self medication आपको नहीं करना चाहिए. और
That's why we discourage intramuscular injections. Now, in my practice, I do write IM injections every now and then, but there are specific indications. We know why we are writing for the patient, and we very clearly tell them, do not take the injection on your own. So, most of the vitamin D toxicity will be if you take intramuscular injection. That is why we said that for Nitin Narula's question, it is difficult to answer at a public health platform. IM injection से toxicity हो सकती है, ओरल से ज्यादातर टॉक्सिसिटी नहीं होती, सो यू कैन टेक सेफली. एंड
बिल्कुल
आदित्य, आपका तो अपना नाम आदित्य है, दैट इज सूरज, द सन, आफ्ताब. आफ्ताब इज इन उर्दू. अब आफ्ताब तो वही है, सूरज भी वही है, मगर डिपेंड्स अपॉन द पोल्यूशन. अब दिल्ली का AQI है 403, हमारे हरियाणा का है 250, बनारस का है 100, गुजरात का भी 100 होगा. सो आफ्ताब तो वही है, मगर आपको कितनी सनलाइट मिल रही है और कितना अल्ट्रावायलेट रेडिएशन मिल रहा है, दैट इज डिफरेंट एवरीवेयर. Similarly, they might be writing 60,000 units, but it is not necessary that 60,000 reaches your bones and your muscles. So stick to a good company, Aditya, whatever you are comfortable with. Yeah.
अच्छा, one thing I want to add, sir, जैसे कि आपने इतना अच्छे से बताया कि इंजेक्शन, डिफरेंस बिटवीन इंजेक्शन एंड ऑरल, इसमें एक और फ्रॉम बायोकेमिकल एंड फ्रॉम फिजियोलॉजिकल पॉइंट ऑफ व्यू से मैं एक बार और बताना चाहूंगा. विटामिन डी का जो आप, जैसे कि सर ने ब्यूटीफुली बताया कि 2 चेक पॉइंट होता है ना, एक लिवर में चेक पॉइंट होता है और एक किडनी में होता है. जो हम विटामिन डी का व्हाट एवर वी आर मेजरिंग द सीरम विटामिन डी लेवल इज एक्चुअली द वन व्हिच इज सिंथेसाइज्ड बाय द लिवर. जो किडनी वाला कर रहे हैं उसका हम नहीं, उनका हाफ लाइफ बहुत कम होता है. दैट्स व्हाई वी आर नॉट डूइंग दैट. दूसरा, if you have lots of vitamin D taken by supplement, then what happens is kidney में there is also one enzyme that is 24 dehydroxylase, वो inactive convert कर देता है. Instead of 125 dehydroxy, vitamin D, that is calcitriol, then it will get converted into 24-25, हाइड्रोक्सिलेज. तो वो इनएक्टिवेट कर देता है, यानी ज्यादा लेने से भी वो किडनी के लेवल में, बाकी के लेवल में इनएक्टिवेट कर देता है. और दूसरा, जब स्किन का भी बात आता है, जैसे कि यूवी रेडिएशन इट कॉजेस सिंथेसाइज ऑफ द प्री विटामिन डी इन द स्किन. वी हैव ऑलरेडी सेड इफ यू कीप ऑन एक्सपोजिंग टू द स्किन, देन व्हाट विल हैपन, वो इनएक्टिव फॉर्म में भी कन्वर्ट हो जाता है. तो नॉट ओनली cholecalcium from vitamin D3, it also get converted into inactivated form. तो in this way आप हाइपर सन, बहुत सारा सनबाथ करने से आपका सन बर्न जरूर हो जाएगा, मगर विटामिन डी का हाइपोटॉक्सिसिटी नहीं होता है बिकॉज ऑफ दिस चेक पॉइंट. दिस आर द ब्यूटीफुल फिजियोलॉजिकल चेक पॉइंट व्हिच आर देयर फॉर डायट्री, इन ऑर्डर टू प्रिवेंट द डायट्री, इन ऑर्डर टू प्रिवेंट द सनलाइट एक्सपोजर. इसीलिए हम ओरल को ज्यादा प्रेफरेंस देते हैं.
Yeah, these checkpoints are very important. And to answer Dr. Vipin Sharma's question, in severe deficiency like 4 nanogram per deciliter, earlier we used to think that IM will be better. But now with the newer oral formulations, actually the speed and the velocity both will be the same. So you might wish to give 60,000 units, sir. For a few weeks, you can give twice a week. You can give every other day also if you want, but oral will suffice. The absorption will be better actually. And in CKD, we give native vitamin D, which is cholecalciferol, because of its multiple benefits. जैसे डॉक्टर वरुण ने कहा, ये बढ़ के पेड़ की तरह है, तो बहुत ही आप एन्यूमरेट करते जाएं. अंशु सिंह जी पूछती हैं रोल ऑफ विटामिन डी इन एंजाइटी एंड फियर. तो इतनी सारी जड़ें हैं, इतने सारी टहनियां हैं, it is difficult to enumerate all in 1 hour. But you have to give vitamin D. If, however, the patient has severe renal osteodystrophy and if IPTH is not coming down, vitamin D is not coming down, then we give activated vitamin D as well. You can give calcitriol.
Absolutely.
Absorption levels, Dr. Kiran asked, sir, will you be able to answer? We have oral sprays also of vitamin D, chewable vitamin D. What are the absorption levels? Dr. Kiran is asking.
Yes, sir. Sir, absorption is ultimate. जैसे कि स्प्रे वगैरह हम जनरली यूज करते हैं, मतलब स्प्रे फॉर्म में भी आते हैं. The point is sublingual and other, जो कि easily systemic circulation में जितना जल्दी पहुंचे, ये that is the aim. But ultimately, I've already told you, it has to go to the liver first. Then liver को bypass नहीं कर सकते, because जो भी आप dietary में ले रहे हो, जो भी कर रहे हो, that is vitamin D3, cholecalciferol. It has to activate at the liver. It has to activate at the the kidney. So even if you are taking in that form, also the beneficial effect may be say faster absorption rate, but the end point will be similar. That's why we always focus on the oral form of the, say, some capsule or tablet or something like that.
Thank you, sir. It's 8 already. So many questions. We acknowledge and we appreciate the questions which have been asked by Dr. Anshul. Very important questions. To Dr. Anshul, I would request, sir, please allow us to answer them next week, perhaps, or maybe later. Sir asks about exercise regimens for normal middle-aged people, elderly people, for hypothyroid people. So we'll have a separate session on exercise, including exercise in obese people and thin people with type 2 diabetes. I'd also like to inform that on the 27th of November, which is next Monday, uh, we have, which is just 2 days from now. Yeah, that's next Monday. Dr. Kiran Kulkarni will be speaking to us about doping, about anti-doping. And sir is a sports medicine specialist, just like Dr. Barun. So feel free to shoot your questions there. सरताज सिंह जी भी हैं हमारे साथ. थैंक यू सर फॉर योर काइंड वर्ड्स. आपकी आंखें सुंदर हैं, इसलिए आपको केके मेट टॉक्स और डॉक्टर वरुण शर्मा की डिस्कशन सुंदर दिखती है. सो दिस फ्रॉम सरताज सिंह. Dr. Namita Kothari has a question on vitamin D. If we can take this up before we conclude. Thank you, Dr. Namita, for joining us. Madam पूछती हैं, ideal dose and maintenance we have already mentioned repeatedly. But Namita ji पूछती हैं, vitamin D from food. आपने बोला that 10% comes from food, but which foods? Vegetarian as well as non-vegetarian.
See, one, we have to understand vegetarian source of vitamin D is very, very limited. So mainly it comes from the non-vegetarian source, vitamin D. इसीलिए fortified की बात चल रही थी. Because in a country where most of the diet comes from the vegetarian sources with limited sunlight exposure, then it is very difficult. इसीलिए तो pandemic है vitamin D deficiency. So dietary source of vitamin D, ideal dietary source of vitamin D3, जिसको हम cholecalciferol कहते हैं, it comes mainly from the animal source, especially from the fatty fish and all that stuff. And plant से भी होता है, like for some calciferol हम कहते हैं argo, especially come from the fungi, like for shiitake mushroom and all that mushroom. ये थोड़ा सा sources of vegetarian का sources हो सकता है. बाकी जितना भी sources है, उनका उतना अच्छा नहीं है कि मैं बोल सकूं, recommend कर सकूं. अगर if you are vegetarian, if you don't drink even milk, if you don't take egg also, then mushroom you have to include. अगर mushroom को आप consider कर सकते हैं तो, like shiitake mushroom and all that mushroom. But animal source is the supreme as far as dietary source for vitamin D is concerned.
The mushrooms also are irradiated, so it is from the irradiation. It's not that the mushroom itself has got vitamin D. If you irradiate them under ultraviolet B rays, then you get the then you get reasonable amount of vitamin D. Thank you, Dr. Namita, for asking that question, and apologies we were late in answering. It's more than 8 p.m. now, and we never realized, Dr. Barun. Now I wonder if there are Bhojpuri songs on what happens when you are gossiping with someone who is good at his work, that is competent, someone who is not only competent but confident as well. Somebody who is able to communicate well in a very compathic manner, in a compassionate manner. All these C's we get from Dr. Barun Sharma. Confidence and competence. Thank you, sir, for your expertise, for sharing your expertise, your experience with us. And thank you also for the compassion and the compathy that you share while communicating with us. We feel so much at home. On behalf of everybody who is logged in today, I'd like to thank you. Our topic today was the secret to sporting success. Of course, we have spoken about vitamin D, its role in muscle building and bone building. That was there. But apart from that, we have spoken about so many other things, how vitamin D impacts the entire physiology from head to toe. We've also learned from you how if we understand physiology, we can automatically understand what we have to do, what we don't have to do. And maybe over coming weeks, we'll speak more about vitamin D and also about other associated things like exercise, how we can use exercise as a means of improving sporting success of all our great countries. Thank you to Swapna Jainji also, madam. Thank you for your advocacy. Thanks to Anshul and thanks for your understanding. We'll do all the exercise topics later soon. And thanks especially to our young boys, Pratik and Dr. Siddharth, who are going to practice novel ways of getting vitamin D based on Bhojpuri music and get back to us with their experience. We have a certificate of appreciation for you, sir. And Faraz is with us backstage. Yeah, that's it. Sir,
Thank
there
you
is
very
one
much.
one last question from physiology. Dr. Avinash had asked, what
बिल्कुल
is the
बताइए.
time of the day when we can generate maximum vitamin D from the sunlight? How much surface area should be exposed? Are there any
Yeah.
formulae for this?
क्या बात है, बिल्कुल बहुत अच्छा है. इसको समझने के लिए यू हैव टू अंडरस्टैंड द फिजिक्स. विटामिन डी जो है जनरेट होता है यूवीबी रेडिएशन, टाइप बी. नाउ द प्रॉब्लम ऑफ टाइप बी इज आपका जो ओजोन लेयर है उसमें टाइप बी को फिल्टर्ड हो जाता है. So the time of the day where your sunlight has to travel more to the ozone layer means less UVB will reach your skin. ये कब होगा? जब जब जैसे शाम का हुआ है ना, जब जब उसका उसका जो एंगल है, the angle from the sun rays to the art, there is no, इसको जेनेट एंगल कहते हैं. It is scientific term, जेनेट एंगल. That जेनेट एंगल has to be more than 45 डिग्री. 45 डिग्री माने आइडियली देखा जाए तो ऊपर में आपका सन है तो आपका शेडो बहुत लंबा नहीं होना चाहिए. बहुत लंबा है, दैट मींस योर सन रेज हैज टू ट्रैवल ऑल द ओजोन लेयर एंड हैज टू रीच यू. तो उतना विटामिन डी सिंथेसिस नहीं हो पाएगा. तो जेनेट एंगल जो है इट हैज टू बी लेस मोर देन 45 डिग्री, तो ज्यादा अच्छा है. नंबर 1 पॉइंट. और पार्ट 2 का जो क्वेश्चन है, हम जनरली ये करते हैं कि एटलीस्ट 35% ऑफ योर बॉडी, 35%, ये बहुत मिनिमम की बात कर रहा हूँ, 35% ऑफ योर बॉडी हैज टू एक्सपोज द सनलाइट फॉर एटलीस्ट 20 मिनट एटलीस्ट 20 मिनट. तो ये होना, दिल्ली की बात कर रहा हूँ, दिल्ली. सो इसीलिए आइडियल कंडीशन में 30 to 60 मिनट इफ यू वर्क विद ऑल. सनस्क्रीन का प्रॉब्लम है, सनस्क्रीन आपको विटामिन डी प्रोडक्शन में प्रॉब्लम करता है स्पेशली. एंड आल्सो इफ यू आर डार्क स्किन में मेलानिन होता है, मेलानिन का कॉम्पिटिटिव होता है, कंपटीशन होता है विद प्रोडक्शन फॉर दिस विटामिन डी. सो इसीलिए डार्कर people they are not able to generate much vitamin D3. This one has to understand. So अगर आपने सनस्क्रीन यूज नहीं करना है और एटलीस्ट 20 मिनट आपको वॉक करना है या कुछ करना है, एटलीस्ट 35% ऑफ योर बॉडी ड्यूरिंग द सन. और कौन सा सन? जिसका जेनेट एंगल मोर देन 45, यानी जिसका आपका शेडो लंबा नहीं होगा, देन इन दैट कंडीशन विटामिन डी विल बी ideally more generated in your skin.
Thank you, sir. Thank you for explaining things in such a simple manner. Simple manner that all of us across Afghanistan, Pakistan, India, we all can understand, and we'll try to implement all these in practice. Vitamin D is important for health. It's important for everybody's health. If all of us become healthier, we become vitamin D sufficient, automatically our sporting activity, our exercise activity will improve. The efficiency will improve. More and more of us will become active sportspersons, sportsmen, sportswomen, and finally more of us will become elite sportspersons, and then we'll get sporting glory for our countries. With this hope, and with the hope that the coming decades become decades of sporting excellence for South Asia, for all our countries. With this, I'd like to take leave. Thank you very much for being with us. Jai Hind, Dr. Varun. Jai Hind, everybody.
Jai Hind, sir.